Stories of survival.
If you have a child that has a disease they would die of and they get cured, you've just given 80 more years to a lifetime.
The bravest kids you'll ever meet.
When she's in pain, she almost refuses to tell you.
And miracles.
They saved my life.
Now you can make those miracles happen too.
Give for Kids starts now.
Your help raises hope. Today, we ask you to be a miracle maker, to create a healthy, pain-free day for all the children and their families that pass through Sacred Heart Children's Center's doors.
Good morning, and thank you so much for joining us for this Give for Kids special. Our Mediathon, I'm Robyn, Nance.
And I'm Deis. For the next half hour, we're going to ask you to be a miracle maker by donating to this amazing cause, Children's Miracle Network and Sacred Heart Children's Hospital.
And with the combined power of TV and radio, we will be asking for your help. 700 ESPN, Rock 94.5, and KXLY News Radio 920 will be broadcasting with us.
Yeah, raising money, not only money for Children's Miracle Network, but hope for the families in our community who need it most. So please stay, watch, and listen as we take you on a journey.
We will introduce you to some of the children who depend on Sacred Heart Children's Hospital and the expert medical staff here who have made it their life mission to ease the suffering and aid in recovery.
The money you donate helps children like Winnie, who has spent the first 9 months of her life in Sacred Heart's neonatal intensive care unit. When Winnie's parents, Ben and Ashley Hawkins, discovered they were pregnant for the first time, they were filled with that kind of joy that only first-time parents can know.
But when this Sandpoint couple had problems with their pregnancy, they needed a lot of support.
And
KXLY4's Casey Lund is live now at Sacred Heart's NICU. He has much more on the Hawkins' long journey and how Forget Me Not, that program, has really helped them along their way.
Yeah, Robyn and Derek, and I'm going to take you inside to meet Winnie here in just a minute. But first of all, I just want to tell you my personal experience with Sacred Heart. I've done a lot of stories and covering the Forget Me Not program, and the work it does for families that are walking down a very dark road is absolutely amazing. And before we meet Winnie, I want to tell you a little bit about her parents, Ashley and Ben Hawkins of Sandpoint, Idaho.
When Ashley and Ben Hawkins learned they'd be parents, the couple was elated. Finding out Ashley was pregnant with twins, a true gift.
You know, I was one of these moms. I barely even drank a sip of caffeine during my pregnancy. I was in great shape.
There's no way to prepare for what Ashley would soon face.
I had been having some issues with my twins, and one of my girls' water had broken at week 17.
We didn't know whether the babies were going to survive or not.
In July of last year, Ashley met an angel, Nurse Carolyn Ringo, coordinator of Sacred Heart's Forget Me Not program.
A lot of our work is actually hoping along with families. Sometimes those hopes change along the journey.
Ashley's hopes were changing. Carolyn Ringo's job was preparing her for a tough reality. Doctors said her twins likely wouldn't make it to 24 weeks. If they did, the chance for infection would be extremely high. Beating the odds, both girls, Winnie and Paisley, were born by C-section around 9:30 p.m. late in July. Paisley, though, was dangerously low on fluids. She lived for just 12 hours.
And they kind of cleaned her up and got all of her IVs unattached and wrapped her in a beautiful little blanket, and they put a little beanie on her head. And they brought her down to me in the room, and I got to spend the day just holding her.
Ashley and Ben were devastated. Carolyn Ringo had already been working hard for the couple to help remember and honor their lost daughter. Build-A-Bear stuffed animals with recorded heartbeats, photos, a memory box, and more.
The way that it was handled was really compassionate, and I can't say enough good things about Carolyn Ringo. I mean, if they could just clone her for every hospital. she's amazing.
She's absolutely an amazing mom.
Still trying to process their painful loss, there was a new battle to fight. The surviving twin Winnie was dangerously underweight with serious complications. Since the time Ashley checked in at Sacred Heart last July, she's only been able to run home to Sandpoint a couple of times, sleeping at the Ronald McDonald House away from her new daughter.
You want to be the one in the night changing their diaper. You want to be the one in the night holding them when they cry. You want to be doing that, not someone else.
Now, Winnie's future is brighter. She has a long fight ahead, but a huge support team in her corner.
I can't tell you how satisfying it is to be able to walk with families through really difficult times and to see healing happen down the road.
Healing that this brand new family desperately needs.
Yeah, and every time I see that story, I get a little choked up because I've come to know Ashley and little Winnie here. And Ashley, we have a special guest with us in your room. It's Carolyn Ringo. I don't think we're going to raise enough money to clone Carolyn Ringo, like you said, but that would be nice. The last time we were here, Winnie wasn't really able to hang out with us. Tell us what she's been through just in the last couple months.
Within really less than 3 weeks, she had 2 surgeries. She had a feeding tube placed in her belly because it's really difficult to learn how to eat when you have tons of oxygen blaring down your throat. So she had to get a feeding tube to go home on. And then she also got something called a fundoplication, which essentially stops reflux. And that made a huge turnaround for Winnie. And then she had heart surgery,
which went super well. And we have some amazing news. The only tears you're going to see from Ashley Hawkins today are those of joy. You're going home for Mother's Day.
Yes, finally a holiday that we get to spend at home. We've spent every holiday here. I checked into this hospital at Antietam the July 3rd, watched the fireworks from my room, and finally we get to spend a holiday at home.
You're an amazingly strong woman, and thank you so much for sharing your story with us. And Carolyn Ringo, the work that you do is absolutely nothing short of a miracle, and we need folks at home watching this amazing story to be miracle makers with us today, and they need to support CMN and be part of a community that helps folks when they're down. And you see the happy ending to this beautiful story here. Nobody's listening to me. You're looking at Winnie. She's absolutely beautiful. They're going home for Mother's Day, but as we've told you earlier in the morning, there's 41 mothers in the NICU that will not be going home for Mother's Day, and they need your help. Please pick up that phone. Call 888-499-KIDS. That's 5437. Donate. Be a miracle maker for just $15 a month, 50 cents a day. You can help keep programs like the Forget Me Not program right here at Sacred Heart, so these parents don't have to walk through this alone. Robyn and Derek.
All right. Unfortunately, we're having trouble with Derek's microphone, but what we can tell you, we have a story that is just really unbelievable. Jeff Humphrey talking to a family who has had some unbelievable trials. Not only have they been here on the oncology ward once, but twice.
Yes, Robyn. If you're lucky, you never have to use your child's name and the word oncologist in the same sentence. But here at Providence Sacred Heart Children's Hospital, there's a family that's actually admitted 2 of their daughters to the cancer ward, and one of them is still fighting the deadly disease.
But she loves to play tricks on her dad, too, huh? Scare him when he comes home from work.
She is a 5-year-old daddy's girl who has already gotten pretty good at hiding her pain from her folks.
When she's in pain, she almost refuses to tell you. She knows it's going to pain her parents, and you almost can't get it out of her.
Unfortunately, Katie's parents are all too familiar with heartache. Leukemia killed their first daughter, Whitney, when she was just 10. Then last May, Katie started displaying the same terrifying symptoms.
And that's what happened. I told that doctor, we've seen this before and there's something wrong. And he was able to figure it out.
Doctors here at Providence Sacred Heart Children's Hospital are treating Katie for a cancer that's invaded her blood supply. Her ongoing chemotherapy caused Katie's hair to fall out a while ago, earning a new nickname from her father.
Fuzzy Wuzzy had no hair.
Katie's leukemia kills off the white blood cells that fight off infections, so her family jealously protects her immune system. The precautions mean no pets for this sweet girl. Her devout parents forced to miss a lot of church. On this morning, Katie's back at Children's Hospital for monthly chemo injected directly into her spine.
No, it is specifically to prevent any cancer cells from growing in the spinal fluid, because sometimes cells can hide in the spinal fluid.
Sadly, Katie is no stranger to the needle. She's endured a lifetime of blood draws and transfusions that can keep her parents and her sisters in the hospital for days.
We feel indebted to all the people here and all the nice things they do for us. And there's a real warm spot in our hearts for this hospital because it feels kind of like home.
And so it's hard to imagine anyone feeling at home here in a place where children fight to live just long enough to make it through grade school. But thanks to doctors and nurses, Katie's latest blood work shows her leukemia is in remission.
Yes, the doctor said that all her numbers were right where they wanted them.
And it means we won't be staying here at the hospital or changing anything that we're doing.
The Mastries say fighting 2 bouts of leukemia would have been a never-ending nightmare without the help of the doctors and nurses here at Providence Sacred Heart Hospital. Doctors are projecting yet another year of treatment before Katie can be declared cancer-free.
And that's why we are actually standing right here. We hope that this is one of the last places that Katie has to stand, because this bell above our heads is where she will ring this. Kids who are declared cancer-free ring that, and then they get to go home.
And I would really like to be here on that day because Katie's family, her sister, her parents are such strong people. Just being around them reminds you of the strength of the human spirit and how it can overcome almost any obstacle. It'll be a great day.
It certainly will, and you can help make it a great day. Derek?
All right, so what is the Children's Miracle Network? Started in 1983, it's a nonprofit organization dedicated to raising funds and awareness for 170 children's hospitals across the country, including Sacred Heart Children's Hospital right here in Spokane. In fact, all of the funds raised over the next 2 days will stay right here locally. Every penny you give stays here in Spokane to help the children who come from all over the Northwest for treatment. Over the last 3 decades, CMN has raised more than $5 billion. Simply amazing figure. That money goes to purchase new equipment, expanding pediatric units, and improving the quality of life for our children. Robyn.
Yeah, and on average, you know, a child a second is admitted into a CMN hospital. It's just hard to believe. 62 children on average a minute.
Yeah, unbelievable. All right, so what makes a hospital like Sacred Hearts run so flawlessly? Of course, it's the hardworking doctors, nurses, even volunteers who make it happen.
And that's so cool. We have been able to see a lot of them in action, and I caught up with the lead pediatric surgeon, Dr. Keith Jorgensen. You've got to see his story. He walks these brightly colored halls with purpose to get to his tiny patients, visiting 10-month-old Nolan, on whom he performed kidney surgery just the day before. Dr. Keith Georgeson has been a surgeon for nearly 40 years, most of that in pediatrics, his passion.
If you have a child that has a disease they would die of and they get cured, you've just given 80 more years to a lifetime, and there's something very satisfying about that.
He's invented a number of procedures surgeons around the world now perform, and he's proud to lead the team at Sacred Heart Children's Hospital.
We have a collection of specialists that are as good as anybody in the field.
Dr. Georgeson says that team offers children in our community first-class medical care designed specifically for them.
So my goal is to make sure that they think this is a fun place to be, even though we're not always doing fun things.
One key, distraction. The building itself decorated in fun themes, child life specialists easing fears. There's art therapy, pet therapy, games and DVD players, and high-tech goggles for when a child needs an MRI or CT scan and has to lie perfectly still.
And we find out what movie they like. We play that movie for them, and they're seeing it in their goggles, and so they're totally elsewhere. They're not here.
Perhaps the biggest deal for the patients is the most surprising push by the hospital.
We want a pain-free institution.
Pain-free at a hospital where there are so many needles?
It's something that I can't stand, to see a child just lying there and then getting needles stuck in them.
In fact, it was watching his own child that spurred his desire to rid the little patients of pain.
I have a daughter that we used to have to strap to a board just to draw blood or to give her a shot. And so from the very beginning, I was tuned into this idea of pain.
How do they do it? Nasal or oral medication, nitrous or laughing gas like dentists use.
It puts them in a pretty good mood.
And there's the JTip.
Something that will shoot medicine, numbing medicine in through the skin without a needle. And they don't feel a thing. It makes a little pop because it's a gun and it has to force it in. But as far as the kid feeling it, they don't.
Then doctors or nurses are able to insert an IV or give an injection, taking away the fear and pain.
We don't want them to feel pain in any way.
Little things making a big difference, none of which could happen without you.
A pain-free hospital. Doesn't
Unbelievable,
that sound
right?
fantastic? And you know, every dollar that people donate goes to things like that JTip. So it really does make a huge difference. And of course, Dr. Georgeson, Dr. Chan, and Dr. Burns are really leading the pain management team, doing an amazing job, trying to push it out to the rest of the hospital.
That's right, making miracles happen. And while we can't put on a white coat and save lives, you know, unless you're sitting at home with like 8 years of training, we can do it by giving to the cause. So please call the number. It's on your screen right now, 1-888-499-KIDS, and be that miracle maker. All right, Tanisha and David Alderson knew even before baby Noah was born, they were in for a very tough road.
Did some tests, and they told us that he actually had several heart defects.
Among other issues, 5-month-old Noah's heart points in the wrong direction and some of his organs are out of place. As they prepared for his birth, they prepared for the worst, thinking they would have to go to Boston for treatment. But the entire team at Sacred Heart has allowed them to receive that treatment right here at home.
So the Children's Miracle Network comes in and they take care of not just the patient, but they take care of the family. And I think it's important for us to have that and have someone to be there to help us.
And the organization that does so much to support that world-class care is now a trusted friend.
And speaking of trusted friend, Dr. Carl Garabedian, who took care of baby Noah and lots of the other babies that we've been introducing people to. Can you talk a little bit about the spirit of that family?
Well, they're a wonderful family, and they've been through quite a bit. You know, baby Noah was a child who we weren't sure if he would really survive from birth, and you know, he's been through quite a bit, and has just been a pleasure to take care of. And that family is been a pleasure to take care of, and they really love that boy.
I think that people have, I would say this because I've taken the tour here at the hospital. I don't think people really realize what goes on here. The types of surgeries you do, it's mind-boggling what your skill is and your knowledge. And different types of surgeries that you're doing here that are not being done elsewhere.
Mm-hmm. Yeah, we've really taken on new types of surgeries here at Sacred Heart, trying to do minimally invasive procedures to minimize the trauma for these babies to still get the good outcomes that they need. And so it's been really phenomenal working with surgeons here, a real collaborative approach in some of the world-class facilities we have here. Not many facilities have hybrid operating rooms that allow us to do, you know, combined minimally invasive procedures on these little tiny babies, and it's just been phenomenal working here.
It's phenomenal having you here and knowing that this is right here in our community. We don't have to ship people to big cities. It's right here.
Yeah, it's been great. You know, it's sometimes stressful for families to think of how complex the heart disease these children have, and looking at you know, what they have to go through, and they think, oh, I've got to go to Stanford, I've got to go to Boston, I got to go to New York, and they realize, hey, we have all the facilities here, we have all the skills right here, and it's been great for them, because you know, to take a family and to move such a distance for this stuff is very challenging.
And every dollar that we are raising stays here. And you know, medical costs are crazy and outrageous. And the things that people are paying for, though, if you're sending in money today, what types of things will help you and your little patients?
Well, they help support the families. You know, one thing they do is really help support the families with some of the costs of traveling for patients who are out of town. Equipment here in the hospital has been something that's supported too. Our ECMO or ECLS program is 100% supported by donor dollars, and that's a a fantastic program that we have children alive in this community, which we didn't have before, which we wouldn't have.
We're going to learn about the ECMO coming up in just a little bit. Dr. Garabedian, thank you so much, and we are so fortunate to have you. Thank you so much, Derek.
Be a miracle maker for families like baby Noah's. We ask you again, please call that number on your screen, 1-888-499-KIDS. You can also go to KXLY.com and find all the information there to donate online. And remind you, our radio stations, 700 ESPN, Rock 94.5, which you're looking at right now, and News Radio 920 are also broadcasting live from here at Sacred Heart Children's Hospital, ready to take your donation. We'll be right back.
For Kids special here on KXLY 4, and with you now, Katie Curry, and we're talking about some amazing technology here.
Yes, the ECMO machine, and most of the patients that use it are newborn babies, and when it is used, it has a success rate of 90%, which is incredible considering most of these kids, when they use the ECMO machine, it is a last-ditch effort to save their lives.
Just a month and a half ago, Laura LeDuc sat in this hospital room, trying to stay hopeful, avoiding the thought of life without her 12-year-old son, Jacob.
I continuously asked every time I saw the doctor, is my son going to live? Is he going to make it?
A question Laura couldn't believe she was asking.
I couldn't even fathom what would have happened if I lost my boy.
A question doctors didn't know how to answer.
They just looked at me and said, we really don't think that he's going to pull through. We don't think he's going to make it. We don't want to say yes and give you false hope.
Just days before, she thought Jacob was battling a chest cold. With no history of asthma or even a hospital stay, she never imagined a trip to a Pasco urgent care would end in Jacob being airlifted to Sacred Heart.
They said, you know, he's not responding to any kind of treatment. The ventilator's on full, the highest setting, and it could possibly put a hole in his lungs.
Doctors compared Jacob's condition to a severe asthma attack and plastic bronchitis. To put it simply, Jacob could not breathe on his own. There was one last thing they could try, a Hail Mary, if you will, to save Jacob's life.
The one resort we have is the thing called the ECMO machine, and they said it's now or never.
The ECMO machine keeps the heart and lungs working while filtering the blood. In this picture, you can see the ECMO machine pumping out Jacob's so-called dark, bad blood and pumping back in oxygenated, bright red blood. After nearly a week on the ECMO machine, Jacob's condition dramatically improved.
They saved my son's life. The ECMO machine saved my son's life.
Doctors say before using the ECMO machine, Jacob was so close to death, it's remarkable he survived.
I remember waking up in the morning, not feeling good, and then waking up in the hospital, and that's it.
Jacob's been out of the hospital for a few weeks now.
I still can't believe it. Thank you for everything. I'm still alive because of them, and I appreciate it.
Already back on the baseball field.
I play short. I like it because there's just so much action there, and I don't just stand around and wait for the ball.
During the darkest time of her life, Laura says she never felt alone because of the support and care of the staff.
They all cared about Jacob tremendously. They did everything beyond measure to be supportive, you know how to express it more than the word thank you. So compassionate, so supportive, did everything they could.
Laura and Jacob know not every child and family get this lucky. For them, life will go on. Thankful for every day they have with each other.
Whatever you do, don't bring up sports around my mom because she's gonna be like, my son's the best and all that, and I don't really want that.
Love that.
Well, doctors are still trying to figure out what caused Jacob to go in such severe respiratory distress, but they say if it was not for this machine, he would have died. Now, do you have a guess how long it took him to get back on the baseball field?
9 months?
3
months?
weeks. 3 weeks after getting out of the hospital, he was back on the baseball field. He has some respiratory treatments he's having to do now for the time being, but he is healthy and he is alive because of the folks here at Sacred Heart.
Amazing. All right, Robyn, back to you.
And that's what I was concerned about. It's like, tell me how.
What an amazing story. And you know, every story is not sad. I mean, look at the great things that are happening because of your donations. You can be a miracle maker and help out kids like her. Be a miracle maker. or call the number on your screen. It is 1-888-499-KIDS. Again, 1-888-499-KIDS. And the money that you donate really goes directly to Children's Miracle Network to help out here at the hospital, even kids like Lauren Franklin.
Who you talked to this morning, right? We first brought you Lauren's story in February when we described the warrior princess who nearly died. The second grader at Moran Prairie Elementary thought she just had the flu, but what Lauren and her family were in for was a big surprise. KXLY4's Alex LaFreeze joins us now in the pediatric emergency room where Lauren's story began. Alex.
Well, Derek and Robyn, each year over 15,000 kids are diagnosed with type 1 diabetes. Each story is different, but almost every time one element remains the same, the element of surprise. For Lauren Franklin and her family, who came to the pediatric emergency room here at Sacred Heart Children's Hospital, it was no different.
In early February, 7-year-old Lauren Franklin began experiencing flu-like symptoms.
On the third day, she rolled off of her bed and was breathing heavily, and that's when we brought her to the ER.
Doctors at Sacred Heart quickly figured out what was wrong, with a diagnosis no one expected.
We were very shocked when they told us it was diabetic shock, and we said, well, she's not a diabetic.
Lauren was diagnosed with type 1 diabetes. Her body temperature was 90 degrees. She was fighting for her life.
And they had given her a 10% chance of survival.
For close to a month, she received world-class care at Sacred Heart Children's Hospital.
And I remember walking down that long hall every day for 3 weeks. And for the first 3 days, that walk, not knowing if she was ever going to leave.
The caring staff worked overtime to make sure Lauren and her family were okay.
Yes, I remember the night nurse. She was so nice, but she used the purple poker on me.
And there were so many nurses and doctors and people who came by just to see how she was doing, and that meant the world to us.
Little by little, Lauren came back to life.
The first time she moved her finger was probably the best moment.
She's now made a full recovery and is back in 2nd grade at Moran Prairie Elementary School. But Lauren still has a long road ahead of her.
This gives me insulin. You turn it on, says my name, say confirm, and it shows you the last bolus and stuff, how much insulin's on board, and my pod expires today.
Her family, grateful for the Children's Hospital, who went above and beyond for their baby girl.
Just the level of care that she received was exceptional.
And thankful for the tools the Children's Miracle Network provides.
What they are able to do with that money is give resources to children's hospitals that they otherwise wouldn't be able to afford. And those resources are everything from life-saving equipment to the games and toys that help in the recovery and therapy once kids get out of that critical care.
For Lauren, it's much, much simpler than that.
And they saved my life.
Abigail encourages every parent to get their child tested for type 1 diabetes. Robyn and Derek will send it back.
Alex, thanks so much. And thank you for watching and helping us make miracles happen.
Yeah, take care. Remember, your help raises hope.